A respirator called.
We all know masks are a must, but are we wearing the right ones? This doctor says no. She says many Canadians need beefier N95 masks.
If you have to be in a factory or a mail sorting facility, or you're a teacher in a classroom, these are all crowded, high-risk places and should be wearing respirators.
That's because there's mounting evidence that the virus mostly spreads through tiny aerosol particles that linger in the air, not mainly through droplets from things like coughing or sneezing that fall to the ground. This paper, published in the medical journal The Lancet, is clear COVID is airborne, and using better masks and ventilation would save lives.
The number of deaths that are partly attributable for taking a flawed view of the mode of transmission are huge, huge.
That view a flashpoint at a recent online panel on the topic.
We need to start treating this for what it is, which is a dominantly aerosol transmitted disease.
Yeah, I would completely disagree with you, Dr. Fistman.
That objection matters. This Canadian doctor is a key advisor to the World Health Organization. He insists current practices are good enough to limit the spread of COVID-19.
Social distancing, or physical distancing as some call it, hand hygiene, cleaning and disinfection of surfaces. That's where our focus should be. This science about how it's transmitted and where it goes, it'll get itself sorted out.
But many experts say Dr. John Conley's stance is hindering the fight to contain the virus.
He does carry a lot of weight with WHO, and unfortunately, I think his thinking is still stuck in kind of what we knew 20 or 30 years ago and hasn't really updated.
For his part, Dr. Conley says he's just one voice among many at the WHO. But as Canada struggles with more contagious variants, calls to treat the virus as primarily airborne now are growing louder. Aaron Collins, CBC News, Calgary.